Hello, I am Dr. Vibhor Borkar. I am Pediatric Hepatologist, Gastroenterologist and liver transplant physician practicing in Mumbai area. Today, we'll be discussing one of the most important topics like donor selection for liver transplant. Every year, there are thousands of children who are diagnosed with the end-stage liver disease, and only ray of hope for the life is liver transplantation. Today, we will simplify this part of this selection process and see the details. So when we are considering liver transplantation, there are two types of liver transplant. One is living donor liver transplantation, means a part of liver is taken from a living person, and another is a cadaveric liver transplantation, means a liver or the part of a liver comes from a person who has pledged his organs after the death. So first, let's see the details of living donor liver transplantation. Here, selection of a living donor is most crucial and the important part of the process. Let's see who can be a living donor. Most important is that person should be a blood group match person. What does it mean? If a recipient is of A blood group, means that person can receive an organ from a person whose blood group is either A or blood group O. If a person is from B blood group, that person can receive an organ from a person with a blood group O or B. If a person is having AB blood group, means this person is universal recipient and can receive an organ from a person who has any of the blood group, that is A, O, B or AB. However, if a person is of O blood group, here the donor should have a O blood group only. Here the positive or negative factor doesn't matter. Another important aspect is the age range. Here the donor should have a range of 18 to 55 years. Less than 18 years, that person is minor and cannot give the consent even if the person is healthy, and above 55 years the health risk increases far. So we generally avoid a person who is more than 55 years of age. Apart from this criteria, the person should be a near relative. What does near relative means is, for all the donors, that person can be of the same generation like brother, sister or spouse, one generation above, like it can be one of the parents like mother and father. Two generations above, it can be one of the grandparents, paternal or maternal, grandfather or grandmother. It may not be applicable to a pediatric, but for a person who is a little bit older, they can also have son, daughter, they can be a donor, or grandchildren from the both the sides, from the daughter or son, they can also be the donor. However, in the pediatric case, here mostly the donor are limited to the parents and the grandparent generation. Apart from that, the donor should be healthy. They should not having any major illnesses. Also, the person should be willing and there should be a good psychological health. These are the important aspects that we see when the donor selection is considered. Now, once the family has identified a donor, we call them as a prospective liver donor. Now, we need to see if this person is physically fit or not. So we run a lot of tests which include the fitness for a multiple organs, because it is a big surgery and all the organs need to be healthy. So the blood test involves which see whether your other organs like kidneys, heart, lungs, they are fit or not, apart from the liver fitness. After the blood test, we do imaging. It means we do a CT scan, MRI or MRCP of the liver. The idea is to see anatomically, means the structure wise, is liver is normal or not, the blood vessels and the bile ducts are formed well or not, so that a proper part of the liver can it be carved from the bigger liver. That is the aim. Apart from that, it also look at the health of the liver and any anatomical variations where sometimes the surgery may be difficult or challenging when a part of a liver is removed. Once these important tests are done, there is a group of doctors or physicians of a various specialty which will review all your tests and give a fitness. When all the doctors agree, okay, the donor is fit to donate the liver, only then you get a permission to donate the liver. After this, there is a psychological evaluation to see whether the mental fitness of a donor is adequate to undergo such a major decision. Once the blood tests are done, there is an authorization committee which looks at the legal and medical aspect of this donation. The major objective of this authorization committee is to see whether this donation is voluntary, whether the donor understands all the risk and benefit involved, also to see if there is a financial aspects involved in the donation. So these are the important aspects and criteria used for a donor selection. Now the other aspect is the safety, which is most important. So we must remember that no surgery is 100% safe. So even the liver donation can involve certain risks. What we always fear is about loss of life. And yes, 1 in 300 to 500 donations, this can happen that a person may lose the life. That's why so many detailed investigation, tests, CT scans are done, and so many doctors are involved to certify the health of the donor. So the utmost care is taken so that the donor doesn't get any risk. If any point we as a team of doctors find that there is a risk to the donation life, we do not select that donor at any cost. So this is the most important, because the donor safety is at the most important aspect of this process. Now let's see the selection of the donor in deceased donor liver transplantation. In deceased donor liver transplantation, the organs come from a person who has died and his relatives has placed his organs. Many organs can be donated like liver, heart, kidney, pancreas, intestine, lungs, bone, eyes and skin. So it's a huge list, and when a relative is pledged to donate the organs, so many lives can be saved, or so many people can get a second chance of the life. Now, how does this liver distribution occurs? In India, there is a centralized agency that is called as NOTO, which means National Organ and Tissue Transplant Organization. This is a central organization which decides the distribution of organ across the country. Apart from that, there are regional and the state organization. These are the part which are called as a ROTO and SOTO, which helps in a proper distribution at the central level. As we know that the need of the organs is far more than the actual supply of the available organ from the deceased donation, to distribute the organ, a list is maintained. Once you are looking at a cadaveric donation, you need to put your name in a list and wait for your turn. So this organ distribution depends on one, that is what is the blood group. So the donated organs are distributed as per the blood group. Also it depends on who has registered earlier. So the person who has registered earlier does get a preference in the list. Similarly, in certain situations, where is a life-threatening situation like acute liver failure, one can get listed as a supra-urgent donation and get a preference over the others. But however, these are the limited situations. So overall, when you are looking for a cadaveric donation in India, the waiting period can range from 6 months to 1 year. So this was in short about the cadaveric liver transplantation. So whether it is a living donor liver transplantation or cadaveric liver transplantation is a team of multidisciplinary specialty doctors who decide whether a particular donated organ from a deceased donor or a particular living donor is suitable for that particular recipient or not. So to conclude, we know that liver transplantation is medically complex and emotionally challenging decision. Here, the safety of the donor is most important, and we as a team of doctors are always there to help the family and the patient to this journey should that happen safely. Thank you.